Nasal lymphoma, a focus on nasal T-cell lymphoma, or you can say idiopathic midline destructive disease, now known as nasal T-cell or natural killer cell lymphoma. So this nasal cell lymphoma is a rare disease which is progressive disfiguring despite systemic therapy. Outcomes are poor and surgery limited to the biopsy. This T cell lymphoma is characterized by abnormal growth of T cells in the nasal cavity. It often presents with symptoms like nasal obstruction, nosebleed, and facial pain, with aggressive nature of disfigurement of the face and nasal area. Key points about nasal T cell lymphoma are rare and aggressive, strong association with Epstein Barr virus, and it is disfiguring disease. Clinically, having nasal obstruction, nosebleed, facial pain and pressure, sinusitis, headache, and eye problem may be there, with classically distraction of the front face, mainly involving malar prominence and the nose area. This patient, male 55, present to me with this aggressive ulceration on the palate with nasal destruction on the left side. So on biopsy, I did the biopsy in this case and found to be natural T cell lymphoma. Workup for nasal lymphoma, nasal biopsy, nasal endoscopy, imaging CT, MRI and PET scan. Sometimes bone marrow biopsy is required for the staging or metastasis of nasal lymphoma. In CT scan, there is erosion and destruction of septum, obliteration of the nasal passage, and destruction of hard palate, orbital walls, and erosion by the expansile mass. And it's commonly originated from the maxillary sinus that obliterate the sinus and nasal passageway. And there is periintral soft tissue infiltration is also there. This tituated imaging MRI distinguishes tumor from the benign mucosal thickening. Lymphoma has relatively low tituated signal intensity and may appear as this heterogeneous mass with calcification and hemorrhage inside the tumor. You can see this picture. This T cell lymphoma may have DD like midline destructive disease, vaginous granulomatosis, and B cell lymphoma. Sinonasal lymphoma is most commonly non-Hodgkin's T cell lymphoma, a component of disseminated aggressive disease. To differentiate this from B cell lymphoma, it appears large soft tissue mass with bony remodeling, and there is less bony erosion in the B cell lymphoma. While in T cell lymphoma, there is more bony destruction and small size of tumor destruct more bony tissue. So this is the difference between the T cell and B cell lymphoma. The most common treatment for early stage nasal T cell lymphoma is the radiotherapy, often in combination with chemotherapy. The type of treatment depends on the stage of the lymphoma. In stage 1 or 2 lymphoma, treated by the combination of chemotherapy and radiotherapy. And stage 3 and 4 treatment is the 3 cycle of chemotherapy followed by autologous hematopoietic cell transplantation. Surgery is limited to the debulking of tumor and biopsy to confirm the diagnosis, and in some cases we required immunotherapy as well as targeted therapy.